So, good afternoon, students.
Good afternoon, sir.
Good afternoon, sir.
Good
So,
afternoon.
do you have any doubts from the previous class? Can anyone just tell me what is subunit vaccine?
Sir, in which pathogen is taken?
In which pathogen is taken? So
Some
I think. Hmm. Okay, Tanvi, you were telling about it.
Yes, in this vaccine, some components of the vaccine of the pathogen is taken, and it is the particular part of the pathogen which is taken in the subunit vaccines.
Okay. Okay, and another very important question is like when we give a vaccine, what kind of immune response we see or which is important? Yes, Manaswini?
Sir, so when you first give a vaccine, you will see an innate immune response, and then later, when the pathogen actually attacks, it will be an acquired one because of the
Okay.
vaccine.
No, but I want to know which component is there, like what develops first. No, I think last time we talked about it, I showed you a picture also, and I said that antibodies are developed, and then the
B
important thing
cells.
is that a memory response is developed, memory B cells. Students, whenever we are talking about vaccines, keep it in your mind. The whole purpose of giving the vaccine is to develop the memory response. Okay? Because see what happens when you are given a vaccine, you don't have any disease at that time, right? So you actually don't need antibodies which can go and fight with the organism, right? You are not facing any pathogen at that time. Okay, so the whole purpose of giving a vaccine is to develop the memory response so that whenever the real pathogen attacks in the future, right, your system is ready. Okay, and the secondary immune response, it is quick. Okay, because it remembers that I have seen this pathogen, I know how to fight this pathogen, and I have um, uh, the weapons to kill this pathogen, right? So this is important. So I'm sure you all understand, because आजकल we all are talking about COVID vaccines, right? So we are getting vaccinated when we don't have the disease, right? But we just want that our body develops antibodies, it develops the memory response or the memory B cells, so that if the actual COVID or the SARS-CoV-2 virus enters our body is ready to fight and eliminate the real pathogen. Okay, that is important. Okay. Uh, okay, can anyone just discuss what is herd immunity? What do you understand by this term herd immunity?
Sir, may I?
Yes, Vivek, go ahead.
So, sir, basically, herd immunity is when I guess the majority of a population, or like a certain amount of a certain like large number of that population, it becomes immune to the specific disease that's in question, and due to this, that's going to make the that's going to slow down or make the slow down the spread of the disease, or make it difficult. uh, because of herd immunity, even though the whole population in question is not immune to the disease, they all become protected.
Yes, so what happens when maximum population is vaccinated, then few individuals who are not vaccinated, and there are many reasons for that. Okay, so some people who are not vaccinated, they also get the protection. And another very important thing is that it reduces the spread of infection, because when the virus transmits from one person to another, right, it sees that, okay, this person is vaccinated, the virus gets eliminated. Okay, so the spread of the infection, it reduces. Therefore, it becomes very important that maximum population. Okay, and for most of the diseases, or for different diseases, uh, how much population should be vaccinated? It depends on the disease, right? It depends on how infectious the pathogen is, okay, and how easily it can transmit from one person to another. Okay, so there are various factors. So for some diseases, even if 80% population is um vaccinated, it works fine. For some diseases which spread very easily, more than 95% of the population should be vaccinated. Okay, so there is a formula about herd immunity threshold. There is a calculation for that. I'm not going to discuss that today. We'll talk about it when we'll talk about herd immunity later. Okay, so I'll tell you the concept of herd immunity threshold, how much population should be vaccinated so that the population overall is safe from the disease. Okay. Okay, let me see what other important thing was discussed last time. Okay, so we basically talked about the pre-independence efforts in India that led to development of various vaccines, right? So we have actually started with the history of vaccines. So we'll be talking about vaccines first, and then maybe today in the next hour we will talk about the history of immunology, right? So immunology started with this vaccine development, but then of course there later on there were a lot of other scientists who actually started giving the insights of the immune system. Okay, so that we will discuss in the next class. So I think let me share the slides with you. We'll see. I'll just recap in 2 minutes what we have learned in the previous class, and then we'll start with the today's like last time we talked about pre-independence efforts. Today we'll be talking about the post-independence efforts. Okay. Okay, so I think you all remember we started with smallpox. I hope you remember. Uh, okay, now my another question is, what is variolation? Okay, Shakti, Shakti.
Yes, sir. So variolation was the process which was used to develop smallpox vaccine. So in that, the pulse of the patient was taken, and then it was heat dried, and then it was given to other people, so they can inhale it, and then their body can generate immune response.
Yes, so basically that was the process where the dried pus was like inhaled by the person, right, through their nostrils. Okay, so this was the process of variolation, and later on, the vaccine was developed by Edward Jenner because he observed that the milkmaids, they were not getting this disease, and he found out that it was because of a disease in cows which is called cowpox. Okay, so that cowpox was giving some protection, right? And any idea like how cowpox can prevent from uh, smallpox? Students, any idea?
So, since it's of the same family, it provides immunity.
Yes, so
Uh,
sometimes what happens, so they are very similar viruses, okay, and some of the epitopes are common, right? So what happens? The antibodies, they were being developed against the cowpox, okay, but because the epitopes were similar, they were also providing protection against the smallpox, right? Okay, so we have talked about this, and then in 1802, the first dose of smallpox vaccine lymph in India it arrived. So, student, this is another very important thing. I have written vaccine lymph, right? So basically, at that time, they were not having the proper vaccine, the purified vaccine. What they were doing was they were getting the lymph fluid, right, of the cows, and they were using that as the vaccine. Okay, it was only later on that the proper vaccine that we see today was developed. Okay, so this vaccination was more effective, and therefore variolation was outlawed, right? Because there were a lot of issues with the variolation process. And, you know, uh, as I said, I think in the last class also, the awareness was very less at that time, and also the injection process was also very painful. It was not the injections that we get today, right? We just have a small needle, but at that time it was a very different uh, injection, right? It was a very painful process. So there was very less uh, people who were ready to take the vaccine, and therefore the government had started with the Compulsory Vaccination Act, right, to ensure higher coverage. Smallpox vaccines, they were imported from Britain at that time, right? So obviously, जैसे जैसे so the government started with the compulsory act, right? Compulsory Vaccination Act. So more people started getting vaccinated, but the supply which was coming from the Britain, that was limited, right? So over a period of time there was shortage of vaccines, and the government then wanted that it would be good if we can develop the vaccine here itself, right? And so for that, a lot of research efforts were made, and ultimately we achieved success in developing the vaccines here in India itself. And Dr. Hafkind, he was invited to India to conduct cholera vaccine trial, because during that time there was a cholera pandemic in India. So government of India requested Dr. Hafkind to come over to India and conduct the cholera vaccine trial. And this trial was carried out in different states of India, and the vaccine showed to be effective. Okay, and then at that time, even the plague epidemic started. And again, Dr. Hafkind, the government asked him to develop a plague vaccine. And for developing that vaccine, he was given 2 rooms in Grant Medical College in Mumbai. And he, over a period of time, he worked there and developed the plague vaccine, which is considered to be the first vaccine that was developed in India, right? Okay. So that was all before independence. Okay, now India became independent in 1947. Okay, and the government in 1948. So obviously, after independence, the government was thinking what all, which disease they should like stress upon. Okay, and in May 1948, Government of India issued a press note which said that tuberculosis was assuming epidemic proportions, right? So government decided that because tuberculosis is increasing in numbers, it is important to try to work in controlling of tuberculosis. Okay, so for that, the BCG vaccine laboratory was developed at King Institute in Madras. Okay, so it was set up in 1948, right? So in 1948 itself, the government decided that we should be working for control of tuberculosis, and in the same year, a laboratory for vaccine BCG vaccine development, it was set up at the King Institute in Madras. Okay, so August 1948, first BCG vaccinations were conducted as a pilot project in 2 centers. Okay, so you can just see in May the government released a press note, and after that a laboratory was developed, and in August, just after 3 months, the first BCG vaccinations trials were conducted. Okay, so those trials, of course, they started with only in 2 states. Okay, and with the success in 2 states, the government extended it to schools in all states of India. Okay, and at that time, International Tuberculosis Campaign, it supported the government of India in expansion and scale up of BCG vaccines, right? So obviously, if the government was targeting tuberculosis, again, it needed more money for that. It needed more vaccines for that. So there was International Tuberculosis Campaign, which funded the government of India to for the expansion and scale up of BCG vaccines, right? Now, later on, BCG vaccination, it became part of the National Tuberculosis Control Program in 1962. Okay, so now later on in 1962, government developed this National Tuberculosis Control Program. Okay, so the BCG vaccination, then it became part of this program. Now, large BCG trials were carried out. Okay, and this one of the largest BCG trial at that time, it was called the feasibility study for TB prevention trial. Okay, so this was the name of that BCG trial. Okay, it was conducted in Tamil Nadu, and it was a very one of the big program, one of the big trials in which uh, the individuals, they were assessed for 15 years, right? जैसे what the individual was enrolled in the study, उसको vaccine दिया गया, and they were assessed for almost 15 years to see the effect of the vaccine, right? So it was a very big study, and after 15 years, the trial showed that BCG vaccination did not offer significant protection against tuberculosis. Okay, so it's like the vaccine was given, but it was not as effective uh, as we thought of. Okay, and therefore the BCG vaccination policy was revised. Okay, so even so, what was the revised guidelines? That the BCG vaccine should be given at an early age. Now I think you know that when the child is born, within first few months, the child get the BCG vaccine, right? But at that time, so like if it was given to adults, it was not very effective. Okay, so after this study, right, after the government of India revised the vaccination policy, many other countries, after studying this trial, they also revised their policies, and then uh, the BCG vaccine was given to people in their early age. Okay, so this was one of the big success story of Indian research institutes in conducting large-scale vaccine efficacy trials, right? So obviously, once you do such big activity, you get the experience, right? You get the experience how we can do this. So now, therefore, it was like it was a big success story for Indian scientists at that time. Ki India did something and the world followed them. Okay, so it was a very big thing at that time, right? And during that time, another very important thing happened, that globally all the experts, like the medical people, the scientists, so all those experts, they started discussion on the possibility of smallpox eradication, because the vaccination for smallpox was available, and there was a talk going on that we can eradicate smallpox from the country, from the world, right? So there was a lot of deliberation on this aspect, and finally in 1958, the World Health Assembly, it passed a resolution to eradicate smallpox. Okay, so this resolution came in 1958, that by World Health Assembly, that we will go and try to eradicate smallpox. Okay, and of course for that a lot of efforts were required, and for that every individual in the on the earth was needed to be vaccinated. So it was a very big task, right? You can just imagine, even today, we want that everyone should get vaccinated, which is for COVID, which is a very big, very difficult task, right? And we are talking about 1958, when the systems were not that good. You can just imagine उस time ना तो internet था, ना ये phones easily available थे. So it was a very big task, very big challenge at that time. Okay, so we have already discussed these points, like smallpox vaccination in India, and in 1958 it was declared that smallpox should be eradicated from the world. In 1962, National Smallpox Eradication Program was launched with the target of successfully vaccinating entire population in next 3 years, right? So the target was in 1962, a program was initiated which was called the National Smallpox Eradication Program. Okay, and the target was that whole of the Indian population has to be vaccinated in the next 3 years. Okay, so for that, for the next 3 years, 5 years, mass vaccination campaigns were conducted, right? However, the coverage still remained low, right? So I think you can understand it was not an easy thing. And what I hear from my parents is that when the team came to the villages uh, with those vaccines, a lot of people, they just ran away. They were hiding in the fields so that they do not get vaccinated, right? So it was really difficult at that time to vaccinate the population. Therefore, the coverage remained low. Okay, so from 1968 there was revision of strategy for India. The focus was on surveillance, epidemiological investigation, and outbreak containment. Right. So obviously, the government needed to uh, revise its policies, right? And then in 1969, bifurcated needle became available for vaccination. So that was a change. Uh, I don't know if you are aware of it. Maybe I'll show you a picture of bifurcated needle. So initially, what used to be done, the skin was scratched, right? And then the vaccine was injected, right? But then bifurcated needle came. It has two um, ends, so it was just inserted like this into the skin, right? So that became available for vaccine, and I'm sure if you see elders in your house, you will find a very big mark on their arms here, 2, 3 you will see. So those were because of these injections, right? So later on in 1971, new and more stable, efficacious freeze-dried vaccines became available, and with that there was intensive search campaign for smallpox. And on 17 May 1975, last indigenous smallpox case was reported from Bihar in India. Okay, and 24th May, last smallpox case reported from India was imported from Bangladesh. Okay, so this is what I was saying last time. Even if our country is free from the disease, we can still get it from other countries. Okay, so we need to uh, get vaccinated till the time the disease is gone from the world itself. Okay, so last indigenous smallpox case was from Bihar, and later on another case was found, but it was uh, from Bangladesh. So this person from Bangladesh came to India. Okay, and in 1977, Operation Smallpox Zero, it was run in the country with intensified effort for such case and contaminant and ongoing vaccination. So now everyone knew that we are very close to it. Okay, so a new campaign was started, Operation Smallpox Zero. Okay, and so you can see it started in 1975 and it went on till 1977. So if there is no case in a country for 3 years, right, then it is considered as free from that particular disease. Okay, so you can see India was declared smallpox free. Okay, and last case of smallpox from any part of the world was reported in Somalia. So in Somalia, we had the last case of smallpox. Okay, and then 1 year later, another case was observed, but that was because of uh, like leak from the laboratory. Okay, in United Kingdom. So last case of smallpox was due to laboratory outbreak in UK, and in 1979, 9th December, world certified smallpox free by Global Certification Committee, and on 8th May 1980, the World Health Assembly declared the world free from smallpox. Okay, and that the disease has been eradicated from the planet. Okay, so this was the first case when a disease was totally eradicated from the earth. Okay, but even after this, there were uh, two labs in the world which kept the stock of that virus, which is the smallpox virus. So one is there in CDC, Center for Disease Control and Prevention, Atlanta in US, and there is another state research laboratory of viruses in Russia. So only two centers they had kept these stock of smallpox virus. Okay, now there are like a lot of discussions on it. Like a lot of scientists say that we should destroy these uh, like organisms, whereas a lot of scientists say that no, we should keep them, we should preserve them, right? So I think as an activity, you can also have a debate on it. Like some of you can talk against it, and some of you can talk in favor of it, right? So we may do this activity later as part of your like some activity, right? Okay, so the good thing was we were able to eradicate uh, this organism, this disease, right, which was causing a lot of deaths throughout the world. Okay, so this is one of the very big success stories. Okay, now just after India was declared smallpox free in 1977, in 1978, just after 1 year, India launched a national immunization program, right? So recently, just recently, India had got a great success in eliminating smallpox, right? So they were good on confidence at that time, right? And they had now a very good experience, right? The things were available with us, like we had those carrier boxes, or we had the nurses, or we had the vaccinators. Okay, so the system was set up, right? Because we were working on smallpox eradication. So just after that, because we had that experience, we had that expertise, we had that mankind, uh, India launched its national immunization program, and before that, the WHO has already launched an expanded program on immunization, which is called EPI. Okay, so as soon as India was declared smallpox free in 1977, India launched its national immunization program, which was called as expanded program of immunization. Okay. Uh, so vaccination was offered through major hospitals and largely restricted to the urban areas, and therefore the coverage always remained low. So you can just imagine, इंडियन गवर्नमेंट ने एक प्रोग्राम लॉन्च किया दैट वी विल वैक्सीनेट पीपल फॉर फ्री, राइट? बट those vaccines were available at big hospitals in big cities, right? And I'm sure you know most of the people, they still live in rural areas, right? उस टाइम पे भी lot of population was in the rural areas, okay? But the vaccine was being given through the major hospitals, and that too in the urban areas. So the issue was always there that the coverage always remained poor. Okay, so therefore government had to do something. So the government renamed with some major changes. So the EPI was renamed, its objectives were reframed. Okay, some major changes were done in that program, and it was renamed as Universal Immunization Program. Okay, so that came up in November 1985. So the EPI was later on renamed as UIP. Okay, so in 1985, this UIP, it started with 6 antigens. And what were those antigens? So you can see, I have just put 1, 2, 3, and 4, right? So students, why it is saying 6 antigens? Any idea?
So there could be different strains of the same, like BCG or OPV could have multiple strains.
Okay, any other answer? Any other person? Okay, see carefully, and maybe if you know the full form of these, any idea?
Sir,
Okay, yes,
sir, DPT was like three different. It was a
yes,
combination, right, of
yes,
diphtheria,
yes,
tetanus, and pertussis.
yes, right. So you can see this is one BCG. It's one of the antigen was tuberculosis, oral polio vaccine, two diphtheria, three pertussis, four tetanus 5 and measles 6, right? So the UIP, it started with 6 antigens. So it was launched in 85 with 6 antigens, and you can see for almost next 15 years, right, no new antigen was added in UIP, right? So for a very long time, no new antigen was added, but later on, in 2002, hepatitis B vaccine was added in this UIP, right? But again, it was not available throughout the country. Some 14 metropolitan areas in 33 districts of the countries were only included, okay? Later on in 2006 and 2010, another antigen, Japanese encephalitis vaccine, this was added, okay, but again, it was not in all the areas of India. It was only given in some select endemic districts in a phased manner, okay. Later on, hepatitis B vaccination was scaled to 10 additional states of India. So these were just being added here, and the last one you can see is Haemophilus influenza type B vaccine, which was introduced in 2011, right? And it is basically given as a pentavalent. I hope you understand what is pentavalent. So basically, uh, five antigens together. So DPT, diphtheria, pertussis, tetanus, 3, then Hib 4, and hepatitis B 5. So there is a pentavalent vaccine which include these five uh, organisms, right? So this was how our immunization program it developed over the years. The objective and major focus in UIP were, so one of them was rapidly increasing immunization coverage, right? So vaccination coverage was always low, right? So one of the major objective was that there should be increased immunization coverage, okay, and reduction of mortality and morbidity due to 6 vaccine preventable diseases, okay. So if you are giving that much of vaccine, you expect, or the government expect that the mortality and morbidity should decrease, okay. Improve the quality of service, because I think you can understand, uh, it was not very well established system at that time, so therefore uh, the system was required to be upgraded, establish a reliable cold chain system till health facility level. uh, do you understand what is vaccine cold chain?
Yes, sir.
Yes. What is vaccine cold chain?
Sir, sir, it's the supply and chain management of the storage of cold storage of vaccines. like due
Yes,
to usually vaccines have a lower temperature of storage, and
yes.
if
So
they cross that threshold temperature, it gets denatured.
yes, okay. So what happens? The vaccine, specifically if it is a live attenuated vaccine, we need to keep that vaccine at low temperature, which is around 2 to 4 degree, right? Now, it's again a very big challenge because what happens at a lot of places in India, there is no electricity. Even if you are keeping your vaccine vials in refrigerators, there is no electricity, right? So, what will you do? It's a problem, right? Uh, so, having that vaccine cold chain, so it was a big issue, and because of mismanagement of this vaccine cold chain, almost 50% of your vaccine uh, loses its efficacy, right? So it's a big problem, and at that time it was really a big issue. So therefore, the government wanted to establish a reliable cold chain system, right? And we will be talking about cold chain, vaccine cold chain in detail in a separate class. So we'll have a full class on cold chain maintenance, right? So basically what happens, now just imagine a vaccine is produced in Germany, right? Or if, or for that matter, any part of the world, right? And now that vaccine has to reach a village in India, right? So what happens? The vaccine is manufactured, right? The vaccine will be loaded on to a truck, right? That truck will go to the airport in Germany, right? From that truck, it will be loaded onto the aeroplane, right? The aeroplane will travel all the way and it will reach to the airport in Delhi, right? From Delhi, a truck will take it and bring it to a big hospital. Just for example, it brings it to AIMS, right? Now, AIMS will further distribute it to other areas, right? So from AIMS, again, it is put into a truck or a vehicle, and that vehicle goes to the smaller hospital, right? Now that smaller hospital will further distribute it to the health centers, to the dispensaries, or to the Anganwadis, right? Now just imagine a vaccine traveling from Germany coming to a village in India, okay, it's a long distance, right? And maintaining the vaccine cold chain throughout this travel, it's a big challenge, right? Because things can go wrong at any step. Maybe the truck उसका एसी खराब हो जाए, राइट? मे बी द एयरक्राफ्ट उसमें कुछ प्रॉब्लम हो जाए, राइट? मे बी व्हेन इट इज स्टोर्ड एट एम्स वहाँ लाइट चले जाए, राइट? मे बी व्हेन इट इज बीइंग ट्रांसपोर्टेड फ्रॉम द हॉस्पिटल टू द आंगनवाड़ी सेंटर in a particular box, right? उसका temperature fluctuate हो जाए, so there can be lot of issues, and because of that we lose lot of vaccine doses. Okay. Another objective was phased implementation, where all districts were to be covered by 1990. Okay, introduce a district-wise system for monitoring and evaluation, and achieve self-sufficiency in vaccine production and manufacturing of cold chain equipment. So, uh, and this again was very important. Achieve self-sufficiency in vaccine production, right? So you cannot just always depend on other countries for providing you the vaccine. So at least the vaccines which you can develop, you should develop, and there should be a high quantity of it always available so that maximum coverage can be done. Okay, and then manufacturing of cold chain equipments. Now just imagine, अगर आपको एक रेफ्रिजरेटर भी बाहर से मंगाना पड़ेगा, so that will be a big economic burden for the government, right? So the government also pushed for development or manufacturing of cold chain equipments in India itself, right? उस टाइम पे to have like AC vehicle, it was a big thing, right? It was not that simple. आजकल तो every vehicle is having a air condition, right? And आज के डेट में you also have portable air conditions, right? And you have those portable cold boxes, right? Which you can just put it in your car and plug it in your car, and you can get that particular cold temperature that you need. So at that time, manufacturing of cold chain equipment was also important. So these were some of the major objectives of UIP. Okay. Okay. So now, as I said, India had that experience of elimination of smallpox. India had by that time started working on other diseases, covering other diseases as well. Okay, and during that time in 1988, World Health Assembly, it passed a resolution for polio eradication by the year 2000, right? So now the next challenge came, and the challenge was the eradication of polio. Okay, so again, it's a very successful story in Indian context, and again I'm saying, to achieve this in a country like India, it's always a big feat, right? Because you can understand, India is so vast, so diverse, right? And to reach each and every person, it is so difficult, right? Uh, but uh, obviously, if there is a challenge, we'll do it, right? So the World Health Assembly, they set the target for polio eradication. So Tamil Nadu and Kerala state, they took the initiative in conducting special drive to administer polio vaccine, right? So in India in 1993-94, it actually started in Tamil Nadu and Kerala, that they took the initiative for mass polio vaccines. Delhi state conducted 2 polio vaccine drives. Then national immunization days were like were conducted. And then another very important thing came was the vaccine vial monitor used on polio vaccine vials. So I will be talking about vaccine vial monitors in the next class just after this. Okay, uh, we just have 4 minutes left in this class, so I'll just talk about polio eradication in this. Okay, we'll talk about vaccine vial monitor, but this was a very good step, and it told you if the vaccine is still effective or not. So it tells us about the vaccine efficacy, right? Later on, National Polio Surveillance Project was set up as WHO and Government of India collaboration. And in 1999, the last case of wild polio virus 2 was reported from Aligarh, Uttar Pradesh. Uh, so with this, so now we know that again, we knew that we are very close polio in case of polio eradication. So now the polio drive moved from booth activity to house coverage, and I'm sure you have seen this, people coming to your homes, right? So उससे पहले क्या हो रहा था, that the person had to go to the booth to get the vaccine, right? But then the government launched that like the vaccine will reach to the homes, right? So people or the Anganwadi workers or the people whoever was giving the vaccine, they were going to all the houses. They were asking if there is any child in your house less than 5 years, and they were giving the polio drops, right? So it moved from booth activity to house coverage, right? And social mobilization network was set up for community mobilization of polio eradication efforts. That time, monovalent oral polio vaccine was used, bivalent oral polio vaccine used, and then with all those efforts, in November 2010, there was last reported wild polio virus in sewage sample from Mumbai, right? Cases were not there, but it was observed in the sewage sample, right? Now, if it is there in sewage, it means it is there in some people because people are shedding the virus in their feces, right? So if it is there in the sewage, it means it is the virus is still there in people. Maybe it is not showing the symptoms, okay, but the virus is there, okay. And later on, last case of wild polio virus 3 was reported from Jharkhand. Last case of any type of wild polio virus was reported from West Bengal. And in 2012, WHO removes India from the list of polio endemic countries. So by 2012, India was polio uh, free, right? So that is again another success story. And as I said, that even today we are giving polio vaccine because uh, our neighboring countries, they still have a lot of cases of polio, and we don't want that polio should again come back in our country, okay. So with this, I'll just end the class now, and we'll just meet after 5 minutes, okay.
Okay, sir.
Okay, sir.